Okay, let me see this, make sure that we're on. Okay, and we're on. Hey everyone, welcome back to Health Freedom Iowa's Facebook page for our Thursday edition of Our Lives, bringing you information on health freedom and keeping you updated on all the things that we can on topics that interest you most. Nothing is more important right now than understanding our health freedoms in the purview and the understanding of COVID, or, you know, questioning COVID.com. That's another great website to go to about that. So just wanting to keep mamas posted on maternity care, maternal care, and postpartum and birth as well. What's happening in COVID. Now, I have a sister who's expecting any day now. A friend of mine just had a baby, and I've been super interested in this topic. And who else to call but my good friend, Linda Crownover-Inch. I'm gonna read her bio here really quickly. Linda is a mother to 3 adult children, grandmother to 9, and the owner of Childbearing Year Resources, CYR. You can find that online and on Facebook as well. She has over 30 years offered services in her community as a birth and postpartum doula, a childbirth options consultant, birth advocate, eclectic style childbirth education, touch for labor sessions, and infant massage instruction. CYR's ultimate intention is to provide intimate, inclusive, and socially conscious support, emphasizing respect for bodily autonomy, informed options, informed consent, and informed refusal. Her clients can be assured that CYR is about valuing one's childbearing year rather than profits. Her experience and training includes being a DONA International birth doula training. She's gone through DONA birth doula teacher training, birthing from within, childbirth education facilitator and training, body work for the childbearing year, advanced perinatal massage therapy, International Infant Massage Association, postpartum support, international certificate leadership, International Infant Massage Association, postpartum support, international certificate training, several spinning babies workshops she's been to, and those are for babies who present breech, morphology and Mayim's A workshop, Mothers Matter QC, established 2012. She's the founder of that group, as well as International Cesarean Awareness Network, ICANN leadership training, consistent continuing education. Who better than to help women advocate for their birth and their bodies and their babies? Linda Crownover-Inch, welcome to Health Freedom Iowa.
Thank you for having me.
You're
happy
welcome.
to be here.
You have given so much support to women during birth, during their laboring process, and you really started to help make me more aware of what the COVID process was in hospitals regarding birth, labor and delivery. And it became quite concerning to me. And we actually did another show and talked about that. So will you share with me what is happening in hospitals, mainly in Iowa, but we can kind of look at the national viewpoint as well. What's going on with how women are being treated in hospitals during birth?
Well, first of all, I contacted 9 different hospitals in 6 cities in Iowa. And those cities are Davenport, Bettendorf, Iowa City, Cedar Rapids, Dubuque, and Burlington. Okay. And there were similarities in most of what I found. And I asked questions of whoever answered the phone, which was usually at the L&D desk. I asked questions about visitors. Would the mom, who would be able to come in to support the mom? All of the hospitals that I contacted in those cities allowed, well, no one can allow, that's a different subject. Their guideline was 1 visitor. So that meant that if the mother hired a doula, the birthing person would need to choose between her significant other or the doula. And that's the hospital guideline. So that means, of course, it's going to be her significant other.
Right.
And then the doula is left to virtual support. So some of the other things I ask is, would a mask be needed? And that there were varying answers at each of the facilities about whether a mask was needed. All of the facilities said that they couldn't make the visitor wear a mask because the visitor's not a patient.
Right.
But their guideline is that the mother wear a mask. And they all spoke of this as though it was an absolute, as though she had no right to refuse. It was not a conversation I carried on with them. I just got answers.
Yeah.
My
So
question.
in my opinion, I'm going to say that, it would be concerning to me regarding oxygen, since some birthing mothers already have to be put on oxygen, that it would be concerning for them to be wearing a mask because of lack of oxygen flow back into their body and for their baby. That's something that really just stuck out for me right away. Did you have anything else, Erica? I wasn't sure.
Well, the mask, with the oxygen, but you also have women who have asthma coming in there, and that's a serious issue.
Asthma, allergies, or maybe
yeah.
even allergic to the masks.
I have asthma. My asthma is so well controlled that I don't even take medications or anything for it anymore. But when I had my now 4-year-old, I had an asthma attack while I was in labor. It's my first asthma attack in years. I couldn't imagine wearing a mask.
Oh, yeah.
So I do want to clarify that none of the hospitals said that the mother would need to wear a mask in labor.
Okay, that's good. Okay, that's how I was understanding that for a moment. So thank you for clarifying.
Unless she tested positive for COVID or she refused the test. If she refused the test, then most of the hospitals said, all of them actually said that they would treat her as though she was positive.
Okay,
And
so
then a
yeah,
mask would be required.
the testing for COVID is the large Q-tip up the nose. And how would they get those test results back so fast?
They wouldn't.
Okay, that's what I thought. I thought, this whole time I've been going, how do they know whether they're testing positive for COVID or not? They're going to give them the test, so then wouldn't they automatically have to assume that they were positive until they learned otherwise?
The way I did ask about that, as a matter of fact.
Okay.
And the way that's being handled is if a woman comes in labor and hasn't had a COVID test, they don't test her.
Okay.
During the labor. That what they're relying on is these tests are being done in the OB or the midwife's offices prior to labor. And I didn't think to ask until a little later on after making some calls how this would happen. And generally the tests are being done 2 weeks prior to labor. And so my question there, if I were a mom, my pregnant person, my question there would be, okay, so if quarantine is 2 weeks and I test positive or I test negative with the test at 38 weeks and the guesstimate date is 40 weeks, do we test again?
Right.
Or is that just like testing for a Group B strep?
Yeah, I was gonna.
So yeah, so it's something I didn't think to ask as through all of this, but I did ask, what if the mother opts out of the test, the COVID test, and not test?
Right.
And like I said, they would treat her as though she were positive.
Okay.
So I asked then, what does that mean for the baby? Which I'm going to show you a little bit. I'm going to show you a graph.
Okay.
Can you see this?
It's not
a graph.
it's
It's a chart.
small.
Yeah, it's a chart. It's very hard to read, but this is how I charted all of this.
Okay.
I have at the top the questions and the hospitals at the side, and then I went through and wrote notes and made yes and no whatever the question was to answer, so I can keep track. And I plan to use this through time to keep track. So one of the other things I ask is, well, then if the mother refuses to test, and they were all surprised. Each hospital was surprised that anyone would refuse. They hadn't had anyone refuse yet.
Right.
And I when I called the University of Iowa, I happen to know that's not true because my last client birthed at the University of Iowa and she refused to test for herself and her baby. So
how did that, do you mind if I can ask how that went?
Not well.
Not well. Okay.
Yeah, not well. There were a lot of things about that particular experience that were very stressful. And I can talk a little bit about that because I was their doula.
Right.
But I'll get through this first.
Okay.
So the other things I ask is if she decided not to test, or if she did test positive, would they separate her from her baby? Some of the hospitals said yes, and others said, well, of course we will. And then I asked, well, if that's the case, then will the baby be removed in another room and then washed as though, because that's what we're hearing through social media and stories from other people, that they're scrubbing the babies down as though when it comes out, it hasn't already swallowed vaginal fluid or have it in its eyes and its ears and its nose, and which
Right.
doesn't make any sense. But anyway, all of them said no, they're not scrubbing babies. These 9 hospitals are not. So I asked also about.
Can I touch on scrubbing babies for a minute? If you
Yeah.
don't mind. So
I
when
know.
babies are born, they usually have a vernix coating on the skin, which protects them and actually helps build their immune system. It helps them acclimate to the outside world. It helps their skin, but also that vernix has a lot of healthy bacteria on it that also help to seed the microbiome on the outside of the skin, and also there's seeding that's taking place on the inside of the baby's body for their immune system. So coming through a natural birth and having skin to skin right away, a baby is swallowing amniotic fluid, which has some bacteria in it. Baby's getting healthy bacteria from mom's placenta that helps build the immune system. And then they're also swallowing vaginal fluids on their way out, which are loaded with healthy bacteria, which helps then seed the immune system that's going to help keep the baby alive and well for the rest of their life. So a lot of parents have been requesting that the vernix is not washed off, usually especially using soap with harsh chemicals like sodium lauryl sulfate and triclosan, which is antibacterial, or some other antibacterial agent. Soap alone is naturally kind of antibacterial, but with all of the harsh chemicals and perfumes and foaming agents that are found in baby skincare, a lot of parents just want to completely forego that procedure entirely and just let their baby's natural vernix soak into their skin and do its job. So I just wanted to give that little overview.
As well as leaving mom's vaginal fluids on the skin.
Yes.
That's healthy for the baby as well.
Yes.
So, yeah. So then I ask about release. Oh, I ask about, just because I'm a doula, I ask about video, because virtual support, if one person is going in,
Yes.
some of the hospitals offered iPads or tablets. A couple of the hospitals had laptops that they would let the moms use in the room. Some of them had computers hooked up to television, to a TV screen.
Oh, so they were so it was more visible so they could be more helpful.
Yeah. Yeah, and all of that I can address because I just did that with a client. So I'll address that soon.
Okay.
But I also ask about release from the hospital, release of mom, release of baby. So stories that many of us, well, especially me, I guess I'm going to relate to just me. Stories I've been hearing are early release after an uncomplicated vaginal birth. And recently, this particular mom that I supported was told she could leave within 2 to 4 hours after her vaginal birth. And she was a VBAC, a vaginal birth after a cesarean. It all went great. But they found—
I'm glad for her that it went great. I'm a little concerned about how quickly they're releasing women from the hospital. A friend of mine had a cesarean and she was released within 24 hours and then ended up having some complications at home afterwards. And the doc was just prescribing her antibiotics right away because she had a little bit of pain in the site. And that would not be, in my opinion, healthy standard of care at all.
Well, that was
more liability for mom to be,
I asked about release after following a cesarean and 24 hours.
Yeah.
They all said that the standard that is paid for by insurance companies is 2 days or 48 hours following a vaginal birth and 3 days or 72 hours following a cesarean. But those early releases are happening after vaginal birth. What's most common right now is a release at 24 hours.
Okay.
But my client at the University of Iowa was offered a release at 2 to 4 hours. So then I ask NICU, what if the baby is admitted to NICU? What does visitors look like there? None of the hospitals kept all people out. Some said one visitor, just one visitor, and that visitor would have to stay somewhere in the hospital or stay with the baby. Most all of them said the baby's mother, the birthing person, and one significant other. So that would, and they also related that as the baby's other parent.
Okay.
So this can get confusing for parents very quickly. So I want to, with that, let's also talk, if it's okay, I'd like to talk a little bit about the other option.
Yeah, absolutely.
You asked me to take a look at what's going on in hospitals. Well, in Iowa, there's also the home birth option.
Yes.
Yes.
Proud home birther right here.
Well, in recent weeks, I've been to a home birth as well. So, boy, what a difference.
Absolutely different. And I know that Erica is also a very proud home birther as well.
Yeah.
And my understanding is my record was just beaten.
Your record was beaten?
Yes. My
just recent. Yeah.
So.
Perfect for precipitous birth. Yeah. Uh-huh. So home birth is an option.
Yes.
And taking a look at what that is, it doesn't necessarily mean any of what I just went over.
Right.
None of it.
And so let me explain. I had a friend of mine who's very excited to have a hospital birth. And at 38 weeks along, she called me and said, I want to do a home birth. They are taking the love right out of being able to have a baby and how I feel aligned with that, due to the COVID standards of her only being able to have her husband or only being able to have a doula. And so, yeah, she was immediately wanting to opt for another healthcare provider. And that is possible. You can change, and you have the right to change your birth provider, your healthcare provider, your maternity care, your maternal, wherever you want to birth. You have that right to change at any given point in time. Give yourself permission to know and to do that if it's necessary for what is your best outcome. I just wanted to look at the camera and say that to women. You have that right. You have that option. No obligation to anybody else.
You do not.
Yeah.
Legally, they cannot refuse your change of care.
Right.
So, but I want to also tell your listeners, if they're wondering about this at any point in their pregnancy, what their options are and what their rights are, take a look at a few websites. There's one that's my all-time favorite. It's called Birthrights Bar Association.
Okay.
That's
a great reference.
It is. And Elephant Circle, that's another one that's associated with Birthrights Bar Association. Both of them are led by Inderwood Lucero, who is an attorney and does work for nonprofit as well. But Birthrights Bar Association has a couple of really nice handouts right now in this time of COVID. And one is called, let's see, about this document, Challenges Facing Pregnant and Birthing People During COVID-19. It's a legal and institutional background on what your rights are. So what are specific violations, and it points it out specifically what violations are. And then it goes on, and you can print these documents out. You can see them on Birthrights Bar Association and Elephant Circle website. what are the options and what are the risks? The other one, since we're talking about home birth and someone wanting to switch in home birth, there's another good one on Elephant Circle called "Are You Wondering If Your Planned Hospital Birth is a Good Idea?" And it does walk through what community birth could look like for you. And it's a paper on decision making
Nice.
that would help you to work through that process of decision making. And then there's the thing about hiring the home birth midwife. In Iowa, fortunately in Iowa, on the Quad City side, I was just up in Cedar Rapids with some home birth midwives with my next client at a home birth appointment for my client. And fortunately, we have quite a few. On the Iowa side, we have a lot of home birth midwives.
There are some amazing midwives on the Iowa side, and I'm just very grateful to be in this state. Please, if you are a home birther or you are a home birth supporter, let your legislators know that you support home birth, and we want to keep laws that reflect our access as women and our ability to have access to traditionally trained midwives or direct entry midwives or certified professional midwives, whatever the terminology is. Home birth midwifery has been proven to be just as safe if you are a low risk natural birth as a hospital birth. So if that's something you didn't know was an option, please know that that is an option, and it is your health freedom. It is your right to exercise said option.
Absolutely is. Another good handout from Birth Rights Bar Association that you can find directly on the resource page of the website is Know Your Rights.
Yes, and I went ahead and provided the links in the comments below here for both websites, for Elephant Circle and birthrightsbar.org. And you can peruse and browse that website in order to find Know Your Rights, or just search it.
There's another one too called humanrightsinchildbirth.org.
Okay.
Take a look there. Great website on
Human rights in childbirth. Okay.
Humanrightsinchildbirth.org. Yeah. Hermine Hayes Klein. That's her site.
Oh yeah,
Isn't
she's
she
great.
awesome?
Yeah.
Another one, Birth Monopoly.
Yep, that's a great one.
Yeah, take a look at Birth Monopoly. Evidence-based birth.com also has a lot on COVID-19. Every 2 weeks she does and Rights in Birth. And if people are looking for evidence because they're birthing in a facility and they want evidence for updated information on pregnancy, birth, breastfeeding, and COVID-19, Rebecca Decker does, let's see, every 2 weeks now, she comes out with new and updated information. That's what she does.
So it's evidence-based birth.
I believe it's .com.
Okay.
I think so. Rebecca Decker is her name. She's fabulous. And her next one will be this coming Monday. But go ahead and take a look. She has lots of great information there. So when a provider is telling you that we have to take your baby and wash your baby, this is one that I've looked up several and it's hard to remember them all. When they say they're going to take your baby and wash your baby because they discovered that vaginal fluids have COVID-19, I thought, okay, where does that come from? And a lot of this is coming out now, and there's small studies. Personally, I don't understand why in the past providers would say, oh, we only accept large studies, and all of a sudden providers and hospitals are reaching for these small studies.
Mm-hmm.
I think it's a big mistake that they're making, but time will tell. So the study that I found had 60 participants, very small. And 4 participants had COVID-19 in their vaginal fluids, but none of the babies ever showed positive.
Right.
It started this downhill slide of taking babies away from moms and washing them.
Well, I mean, we've got taking the babies, but I think testing women in such a vulnerable state is also not in my opinion, the greatest idea. We don't want to stress mothers any more than while they're in labor. My biggest concern during this were was when I started to read that mothers were being taken and left alone to birth alone. They
Alone.
wouldn't allow the partners or the doulas in the beginning. And there were all kinds of advocacy things happening on social media. Ricky Lake and Abby Epstein got involved with sharing those things. Naturopath and herbalist Aviva Ram, she got involved with, you know, really speaking out about leaving women alone to birth and having them be alone. That is not how we were meant to birth. We were not meant to birth unsupported and left to the whims of the medical system. We were just, that's not the best outcome for mom or baby, and it's trauma inducing. Do you want to speak on that just a little bit? Because a lot of stuff that you posted is what sparked my involvement in becoming more knowledgeable about what was happening.
In my experience, recent experience since all of this began, I've seen a lot of stress. I get calls frequently from moms who are stressed. What am I going to do? What if this happens? Not everyone is a candidate for home birth, so many people have good insurance, and so they prefer to birth in hospitals. So what I tell them is start the conversation with your provider, and let's talk about where you want that to go.
Yeah.
What are your ideals? What do you want? And if they're saying something is absolute, you can always respond and say, well, wait a minute. I have bodily autonomy. That is the law. So you can't not allow me to do something. Now that sounds easy, those words sound very easy. You can walk into a facility and just say, I'm not going to do this and I'm not going to do that. You really need to investigate and be responsible for the information and why you're deciding to refuse. But there's also informed consent. So the providers and the facility is also responsible for giving you the information to make that decision. So the stressors, lots of stressors. For instance, the week before this last birth experience that I attended, the mom was told that only one visitor was going to be allowed to go in. And that was when the University of Iowa changed their guideline.
Yeah.
And what I saw this mom go through is so unnecessary. It's the system that caused that stress. They were also limiting who could go to her appointments with her in the office. This is a very strong woman also. I was always very proud of her. But she kicked back and she said, well, okay. So if I can't bring my partner or someone with me back in the office in the back office for my visits, then I just won't come in. Their response was, let me check on that.
Right.
And they called her back and said that her husband, who was planning to come with her, could come into the back office. You know, within about 48 hours, the University of Iowa changed that guideline.
Oh, good.
I think she did it.
Good. I mean, this is the thing. It's so much of what has been happening during COVID is actually unlawful. It's actually in violation of
Birthright Bar Association. Look at what they have to say.
Yes.
If you take a look at the piece that they have, the document on challenges facing pregnant and birthing people during COVID-19.
Yeah.
It completely lays out what is legal and illegal. And what I'm talking about is illegal.
Right.
For someone to do that. Separating a mom from her support is illegal. I'm waiting for it to be challenged.
Well, it's the idea that, you know, when we're in such a vulnerable state, to be taken advantage of, to be given ultimatums, choices out of, you know, fear-based choices, it's either going to be this or you die. So many women hear that in their birthing experience. If you don't do this, I'm taking you back for a C-section. If you don't push harder, like, you know, those are the words that I was told during my first birthing experience. And I was pushing for 2 hours. They needed to move me out of that room. That my baby was not in distress. Nobody was in distress but me feeling like I had a deadline to get the baby out. There was, and it was, it was enough concerning for me that I said, I'm not going to be rushed through this process ever again. And so, like the little hen that could, you can choose to have a home birth too.
Oh, home birth is the place where you have to have true autonomy. And it really is the place where your midwife has autonomy as well. I do believe that I'm not against hospitals. I'm not against birth delivery providers. I'm not against support staff such as nurses, phlebotomists. I'm not against that. But I do think that there's a great deal of coercion and bullying that happens to get pregnant women to follow whatever the guideline is that's in print.
Or that's easier for them, not necessarily. I mean, we don't want to negate medical necessity when we know that that is what hospitals are for. That is exactly what providers are trained for. So there's this balance that you have to have with understanding them, but there also needs to be, or could be, a better revision of their bedside manner and of their acknowledgement of your bodily autonomy and of their acknowledgement of the law. And I see a lot of gray areas and a lot of line stepping, unfortunately, in the medical system when it comes to birth.
I have heard with my own ears in a labor one time where a mom was told that they would just wait until she passed out and then they would take her in for a cesarean. And yeah, I mean,
you would be surprised at how often and how common comments like that really are. I mean, the stories to be told by birth workers.
Yeah. And it's it becomes a quagmire of holding your space, and for a mom who's laboring, it can feel like walking through mud. I'm experienced and know what I can hear coercion coming down the pike. And so I can have conversations with the moms. I can't speak for them.
Right.
Or very few times in my career, I've really spoke up for the mother, but that's when bullying has been so horrific that someone had to speak and stop it.
Well, and how horrible it is to do that to women who are in such a vulnerable position as well. This is why most of us turn into advocates after our birth experiences or after what we've witnessed happen in birth, because we have to help those who may not have a voice or who are too busy focusing on trying to have a baby and to stay in a safe space with themselves to be able to feel very protective of them and protect them from coercion, bullying, medical bullying, or unnecessary medical intervention. So one of the things that I wanted to connect with you on is, it even upsets babies to hear this.
She's remembering the day she was born.
She is. She just needed mama. With you, with all of the stories that can be told, one of the things that I've appreciated is how well you've advocated for women and helped educate them on their bodily autonomy, on their medical rights, on their medical freedoms, on hospital policies. And so let's get into that just a little bit as well. Let's say hypothetically we have a new mom and she is pregnant, or a birthing person, a pregnant person is expecting, and they really want to know how to navigate the COVID conversation with their healthcare provider. How would you help walk a mother through those educational resources?
Well, that seems to be the conversation I'm having with moms when they're calling now. They're not necessarily hiring a doula, they're looking for support.
Yeah.
So to begin the conversation, I asked them how they chose their place of birth.
Yes.
And most of the calls are birthing in hospitals. They're surprised to know that they should choose their place of birth first before they choose their provider.
Yeah.
And the questions to ask to choose that place of birth. Some of the things I just mentioned are good questions to call and ask before choosing your place of birth. Once you find the place of birth, whether it be home or hospital, or if you live in another area such as I think around the Burlington area, down around that Champaign Burlington area, there's a birth center, a freestanding center.
Okay.
I couldn't find it, or I would have had a report on it. But anyway, then based on where you've chosen to birth, then you investigate who to hire, and you're hiring a place of birth, and you're hiring a provider. So with that, there are questions to ask in hiring that provider through interview process. So let's skip into COVID-19. If you're birthing at home, there's not a lot of questions to ask that relate to COVID-19.
Right. Well, I mean, some of the questions I can think off the top of my head is to talk to the midwife or any birth assistants who would be coming into your home, you know, like what precautions they are taking. That might be a question.
Oh,
I
absolutely.
Like
All of
my
the-
sister, for instance, who is choosing a hospital birth, but if she were to choose a home birth, I know without a doubt that would be one of the questions her and her husband have for a healthcare provider.
When I've attended a birth some weeks back, the midwives wore N95 masks.
Okay.
Not because they were asked to.
Right.
And the mother said to me, "Take your mask off. I can't see you. I can't hear you." So I had it with me, and it was on for like 30 seconds. So that's completely up to the mom. Home birth midwives use gloves. They use protective equipment. So that's just a given.
And in my experience, my midwives were very careful with sanitation. They were extremely respectful of any wishes that I had, and they were extremely knowledgeable in how to keep everything safe. And should complications arise, they were also very knowledgeable in helping explain to me when would be transport time and you know, what it would kind of look like. And that was just help relieve so many things for me.
I can say in all the home births I've been to, I have never seen an irregularity. I've never seen coercion. I've never seen bullying. I've seen safety precautions. It's really been a good thing. I trust the process. I do. On the other hand, walking into a facility, what to ask a provider, is your provider willing to see you as a human being? Ask them straight up. Are you willing to see me as a human being? How much time do they plan to spend with you in each visit, finding out about you? There are options for home birth midwives, for clinically based, hospital-based midwives as well. And they do spend more time with you. Generally, they're in groups of midwives in the way they practice clinically. But keep in mind also that there's a different way that they're trained between home birth midwives and clinically based midwives.
Yeah, a lot of people hear the word midwife and they say, "Oh, well, I'm seeing a midwife in a birthing center. I'm seeing a midwife in a hospital or in a practice," and that's a very different training than what a traditionally trained home birth midwife or the ancient art of midwifery, how women are trained there.
Yeah, it's not. If a midwife is trained in the medical field, in the medical arena, she may never have, for the majority of them, may never have seen physiological labor and birth, undisturbed labor and birth, only medically the way it's manipulated, and oftentimes the way that coercion and following the rules to birth. But in home birth, that's the way midwives for home birth are trained. They know what medicalized birth looks like, but they're trained in undisturbed physiological labor and birth, a big difference. But in asking questions about COVID-19, a lot of the things that I said when we first started are things to ask, such as, well, number one, what is the cesarean rate of the provider? And what is a cesarean? That'll tell you everything about how they practice. One particular hospital I called today had a 33% cesarean rate.
Wow.
The national average right now is 30, I think we're 32, maybe 30%. I think the latest was 30%. It's changing. And I'm wondering after this, without support with moms in the hospital, what's going to happen to that cesarean rate as well? Will it go
Well,
up?
You know, we've been told it's supposed to go down. You know, all the hospitals have been warned that like if you have to bring that cesarean rate down,
Mhm.
because a third of the US births were all cesarean at one point, and we are seeing an increased rate of maternal mortality, especially in women of color, and that is unacceptable.
And Hispanic.
Yes.
So, yeah, that's a different subject.
It is, but I did want to make sure that we touched on that. Just
brain's
kind of
jumping.
glazed over it briefly and mentioned it and paid it honor where honor is due in
Yeah.
that respect.
Yeah.
Yeah.
So what to ask? All the things, such as will you, to see you, will this provider, will you require a COVID-19 test? What will you do if I disagree with what you're telling me I should do? Will I be allowed to stay in your practice, or will you fire me from this practice? That's something to ask the facility when you call and ask about guidelines and protocols at the facility. If it's a private facility, yes, you can be fired. If it's a private practice, yes, you can be fired. If you go to somewhere like the University of Iowa, which does accept Illinois Medicaid, by the way. Most are not aware of that.
Okay, so if we're on the border of Illinois and Iowa, you can transfer
You can
and
go to
go
the
to that
university.
hospital.
Yeah. What was I going to say about that? I lost track.
If you refuse any of
Question.
if you don't align,
COVID-19. Oh, yeah. Well, fired. Will you get fired? For instance, at the University of Iowa, they can't do that. They can't fire you from the hospital. They can't make you leave. The midwives and the physicians there cannot make you leave their practice either. If you
that's very interesting that the concept of firing patients is really interesting because we hire them, right?
You would think so.
It just astounds me.
But you know, so to answer your question about what to ask about COVID-19, pretty much just go over what your rights are. Go, for the most part, know what your rights are. Go to Birth Rights Bar Association, go to Elephant Circle, go to evidence-based birth so that you can have that conversation. It's going to be pretty much the same conversation about what you want to do with your labor and birth separate from COVID-19. If you want to know about COVID-19 and pregnancy, investigate what it might be like if you are pregnant and have COVID-19.
Right.
Most hospitals have on the maternity, on the L&D wards or units have pressurized rooms for moms who are ill, but all of these hospitals I spoke with had not had a case.
Okay, that's encouraging to know. That's really encouraging to know. So let's say I'm somebody who would not be a good candidate for home birth, and I would have some medical conditions that would not allow me to birth in a home setting. I guess, are there any other resources or hypothetical questions you think would be good to ask a healthcare provider should I already be like a high risk for pregnancy?
Well, I will also want to add someone who may be limited by their insurance where they can go, but also for people who have 100% coverage for hospital birth. That really makes that balance to pay for home birth very, very hard to resist. So wanting to go and have it to a hospital and have it paid by their insurance 100%. So what would I ask? Well, I'll go in this direction. Let me know if I'm going in the right direction here.
Okay.
I would say, ask your provider, what are their guidelines on length of pregnancy?
Okay.
for hospital birth. Usually it's 42 weeks and out, baby out. So what happens if you say no to that? That's a good question to ask.
It's a great question. That is a great question. Considering most first-time moms in particular are usually on an average 10 days overdue.
Yeah. But what if you go
Overdue again, but again, we have to realize that those are just estimated due dates. Those are not guaranteed, like, hey, baby's out, turkey's done, timer's up, baby comes out when baby's ready. Yeah.
We don't ovulate the same as people. And so it's not going to be the same for any of us. I like to refer to it as a birth window.
Yes.
I like it for it to be like a 6-week period from 36 weeks to 43 weeks. I'm on call during that 6-week period for a mom.
Yeah.
But ask your provider what that looks like. Ask your provider how they feel about eating food and drinking whatever you want in labor. If you look at what ACOG has to say about that, about safer birth, American College of Gynecology, women should be eating. Low-risk women, and the majority of women are low risk. Pretty much if you leave things alone and don't fuss with it, don't poke it, you don't get into trouble for the most part.
Right. Well, I mean, we need food and hydration and fuel for anything that we do.
Yes.
And why would birth be, why would we tell someone to go run a marathon and not have any food or fuel? It's ridiculous. I mean, but birth is often likened unto running a marathon. It would only make sense for a woman to be able to eat and drink freely as she feels thirsty, and to be well hydrated and well nourished prior to and during birth and labor. I'm going to mention 6 dates a day. 6 dates a day helps ripen that cervix. There's some scientific studies out on that.
There are creative ways to eat those dates. You can make cookies, you can make date bars. So another thing, these are all red flags. If your provider says, no, we don't do that, these are red flags to leave that provider and go on and interview another one. What about an IV? That's also not necessary for low risk. I've birthed with moms who wanted VBACs and have said, I'm not having an IV. So that's not an easy conversation when you're a VBAC, but I've seen it done.
Yeah, and another thing Erica had mentioned is already just kind of having the IV inserted, or the little, like a small port. So they can just insert an IV quickly if they need to. That's not necessary if you're low risk, right? You can refuse that if you want to. Okay.
I've seen, I've seen women agree to have the IV lock put in and not hooked up to an IV. And then I didn't even notice that they had actually hooked it up and put Pitocin in her body postpartum as a prophylactic measure without her consent. So we didn't know.
It's not that we're against this idea of having help for mom when she needs it. It's about the consent. It's about information, having the conversation and consenting. Unless it were a true emergency situation and she was not able to give her consent, we understand that certain measures would have to be taken.
Yeah.
But then, you would ask the partner or somebody who was there on her behalf to do that. Usually those things are worked out beforehand. But it's the idea that there's the lack of decency, respect, bedside manner, and lack of adherence to the law to actually provide informed consent and just
It's her body.
It's her body.
That is the law. So how about continuous monitoring?
Yes.
Safer birth, don't do continuous monitoring for safer birth. Again, low risk women. Adding medications to your labor. How does your provider feel about adding medications to your labor? If your provider has it says only if you need it, that's a red flag. What about positions for pushing your baby out of your body? Many providers say you can do whatever you want, except when it comes time to push your baby out, you have to be on your back. What an awful position to be in. You're pushing a baby over your sacrum, uphill against your pubic bone. What about being upright? as
Right.
well
What about
as
this wonderful thing called gravity? You want something to come down and out. Gravity is really good for that, not like that. Yeah.
squatting is awesome. So there are red flags to watch for. And anyone can call me at any time and have this conversation with me. It's free.
Right.
Talking to me is free. If you hire me to do something, that's different. But I think it's most important that people have the information they need to be their own decision makers. So those are just some of the early things. And there are, what is it, Motherboard. Take a look at motherboard.com.
Motherboard.com. Okay, we'll add that resource, of course, in the
He is
comments below
awesome.
as well.
He has free handouts for interviewing midwives, what your rights are, what consent looks like. Remember something, we have a few minutes left here, so I want to get this in. One last thing, remember the BRAIN, BRAIN, when you're asking anything. Benefits, what is the benefit of what's being suggested? R for risk, what is the risk of what's being suggested? What are the alternatives for A to what's being suggested? I, intuition, what is my intuition or my gut saying? And N, I need time. If it's not an emergency and you're being wheeled off to save your life, you have time. So you can even go home and make a decision and think about it. Then there's informed consent, collaboration of care, there's informed refusal. All these websites that you're going to post will give you all this great information.
Wonderful. Well, Linda, thank you for being on Health Freedom Iowa today. I just want to shout out your resource information, childbearing year resources. We can post a link to that in the comments as well. And thank you for being such an amazing resource for women in and around the Quad Cities and supporting so many to be their very own health freedom advocate. We have to make these choices for ourselves and make our own informed choices. And I think the best preparation for any newly expecting person is to call the hospitals ahead of time. That's just as much homework as you need to do. As far as where and how you're going to birth is just as important as the nutrition you're going to be eating during your pregnancy.
It's imperative that we are responsible and participate in our care.
Yes.
So thank you for letting me be here. This has been a delight. You know me, I can go down the rabbit hole when I talk about this.
And we both can.
Thank you so much for letting me be here.
Thank you. And we look forward to talking with you and keeping you, thank you for keeping us in the loop of everything with COVID-19. And we will definitely see you guys next time. Look here again every Thursday at 8 p.m. Central Standard Time for our interviews with Health Freedom Iowa and the health topics that mean something to you. If you have a health topic that you would like us to cover or someone you would like us to interview, simply send us a message here on our Facebook page. We're also on Instagram at Health Freedom Iowa. Follow us there. And don't forget to share the things that you find fascinating in and among our health freedoms and know your rights. Have a great evening, everyone. Thank you so much.